Clock show. The American Heart Association, along with the American College of Cardiology, releasing new guidelines for cardiovascular health. The updated guidance includes both new and proven medication options, as well as a recently discovered link between blood pressure and brain health. Joining me with more is chair of the committee overriding these new guidelines, Dr. Daniel Jones. Thanks so much for joining us today.
Glad to be with you. Thank you for having me.
Yeah, so hypertension is one of the leading causes of death nationwide for many Americans. I mean, I think about 1 million Mississippians suffer from it too. So how important is it to keep an eye on your cardiovascular health?
Yeah, it's so important. And one of the important things is to measure that blood pressure. All adults should have their blood pressure measured at least once a year. And of course, if you have high blood pressure, more frequently, and stay in touch with your own clinician to keep that blood pressure controlled.
Yeah, so tell us about these new guidelines. It includes different medication and some new guidance as well.
So we have the first new guidelines since 2017. These are based on new evidence that's been accumulated since the last guideline was done, and we do recommend more people taking blood pressure medication and recommend lower levels of blood pressure control. The 2017 guidelines recommended 130 systolic blood pressure for control, and we're encouraging even going down to 120 millimeters of mercury for most patients.
Wow. How often are these guidelines updated? I know you said the last one was 2017. Are you seeing more importance to update it maybe year by year, or how does that work?
Yeah, so that will change as the evidence changes. More recently, we have been doing this about every 5 to 8 years as enough evidence is available for us to make new recommendations for our clinicians and patients.
Yeah, and that evidence has also given you some new guidance, a recently discovered link between brain health and high blood pressure. Tell us about that.
Yeah, so this is really, really important. We've thought for a long time that likely many people with dementia had some blood pressure related effect. What's been learned recently is that it's clear that reducing blood pressure in those with high blood pressure reduces the risk of dementia. Dementia is such a dangerous and difficult problem, and all of us should be interested in doing all that we can to prevent dementia.
And over the last few years, I feel like I've heard of more and more young people suffering from strokes. Do you think the new guidance will help with that and maybe other areas as well?
Intensive control of blood pressure certainly helps reduce the risk for heart disease, for stroke, as you noticed, for chronic kidney disease, and now, as we know, for dementia as well. So controlling blood pressure is very important.
Right. And besides daily use of medications to control your blood pressure, what are some other steps people can take to maybe lower that on a daily basis?
There's lots of things that people can do to control their blood pressure outside of medication. If you're overweight or obese, losing weight, regular exercise is useful. A diet high in fruits and fresh vegetables and low in sodium is really important for controlling blood pressure.
All right, Dr. Daniel Jones, we thank you so much for the guidance, and hopefully this will help some people in the future lower their blood pressure.
Thank you so much.